talk about some of those. Let's kind of just draw out some of the relationships here. Okay. So based upon what we've just described, we can say that bulk flow is directly proportional to two things. Proportional to our pressure gradient. When our pressure gradient goes up, bulk flow goes up, and to the radius of the vessel, right? The radius, which is R. So these two things are directly proportional to our flow, which means as they go up, flow goes up. Let's look at bulk flow to the other two factors. Bulk flow is alternatively inversely proportional or indirectly proportional to our two other factors that influence resistance, which is length of the vessel and viscosity. So viscosity and the length of the vessel. So which means that as viscosity goes up, flow goes down. As length of the vessel goes up, flow goes down. And then overall, we said that bulk flow is also indirectly proportional to resistance overall. Okay. As the resistance goes up, the flow goes down, and vice versa. Okay. So just three of the relationships we described so far. These are going to be important when you look at different types of questions. Just to remind yourself of how these factors affect the flow, the bulk flow. All right, let's keep going. So let's talk a bit more about resistance and some of the other factors that affect the radius of a blood vessel. So arterioles are specifically important because the radius, their diameter, can be affected by vasoconstriction and vasodilation. So we can regulate the radius of our arterioles and smaller arteries as well with the help of the immune system, and not the immune system, the autonomic nervous system, as well as the nervous system itself, okay, and hormones and so forth. So vasoconstriction, this is when we would decrease the radius and we increase the resistance. So this is when the smooth muscle that lines the vessel constricts or contracts, that makes the lumen smaller or the radius smaller, and that increases the resistance. This is especially important when we want to shunt blood to or from different vascular beds. Let's say I'm working out, just doing physical activity, and I need to shunt more blood towards my skeletal muscle. I can change the diameter of the vessel by modifying the smooth muscle, and that can help me restrict and alter the blood flow to and from different vascular beds. Similarly, vasodilation, this is increasing the radius by way of the smooth muscle chain. This is relaxation of smooth muscle, and that is going to decrease the resistance. So that's going to make it easier for blood to flow in one direction, whereas vasoconstriction decreases the flow in another direction. And if you think about the pulmonary circuit, again, there's less resistance here. So there's lower pressure required in order to drive blood flow for the pulmonary circulation. We don't need as much of a gradient. right? There are lower pressures overall, but there's also lower resistance, which is what equates the flow in the pulmonary circuit to that in the systemic circuit. And then thinking about total peripheral resistance, this is TPR. This is the combined resistance in all of our blood vessels as a whole. And this is specifically within the systemic circulation. So the resistance across the blood vessels depends on the resistance of the vessels independently or individually, but that is not how we look at it. We look at it as an entire systemic circuit because there's no way to really pinpoint which specific vessel is changing the resistance. So we think about TPR as the total resistance encountered across the entire systemic circulation. And the flow is going to differ, it's going to vary between different networks, as I mentioned earlier. So you're going to have more flow to the kidneys, more flow to the brain, less to the GI system, less to the muscle, depending on different types of activity, different scenarios. And then vasoconstriction increases total peripheral resistance, decreases total flow. Vasodilation decreases total peripheral resistance and increases overall flow. So that vasoconstriction, vasodilation, that relationship is still the same, even though we consider resistance as a total across the entire circuit. And then coming back to some of our earlier equations here, we said flow is the pressure gradient divided by the resistance. And then flow can be measured as the total cardiac output. We talked about different ways of finding this number out. The total amount of volume ejected from the left ventricle during systole, that number tells us our cardiac output. It can also be equated by looking at our stroke volume and our heart rate. So stroke volume, total volume ejected, multiplied by the heart rate is our cardiac output, which is also equated to the pressure gradient divided by resistance. And then another way to think about pressure gradient is the mean arterial pressure. And then another way to think about resistance is our total peripheral resistance. So in terms of our physiology, our cardiac output can also be equated by mean arterial pressure divided by total peripheral resistance. So this is kind of extrapolated from this equation and more specific to our physiology. Our cardiac output is our mean arterial pressure and then any divided by any total peripheral resistance. Okay.